Dr. Sanaa Abdelrahman, the role of microbiome in the development of bronchial asthma.
Microbiome, as you all know, are the microorganisms that live on or inside another organism. It is the collection of all microorganisms that, including all the bacteria, viruses, protozoa, fungi. More than 8 million genes are associated with microbiomes in the human body. While microbiota means the microorganisms found in a specific environment, like gut microbiota, respiratory microbiota, skin, or orificial. Why do some people develop asthma? This was early published in 2006 in New England Journal of Medicine, when people were trying to find the etiology or to find like a reasonable explanation why people develop asthma. Is it because of infections or pollutions or animals or exposure to farm animals, or occupational asthma, or exposure to indoor pollution and poverty, allergens, or simply daycare and family size? They said that all those, they contribute to the airway inflammation with atopy, and then they said that there are unknown pathways. Recently, then we started knowing that there is the microbiome that also work with environment and with nutrition on the epigenetics, on the development of asthma while infants are in utero. And there are so many studies that they influence also after that the immune system developed, whether innate or adaptive immune system. How do they do that? Because epigenetics links the environment, nutrition, and microbiome through like the cyanobacteria, and also through the acetylation of the histone, the DNA actually replication. So that will end up in changes in the Th1 or Th2 or T regulatory cells, and also the other chemokines as well, chemokines. Early microbiome in particular, there are a lot of studies on the early microbiome that they show us there is an important role played in the atopic sensitization for even food allergy, for asthma, for atopic dermatitis. And they found that recently that the infants born by C-section, the ratio of the Enterobacteriaceae over the bifidus bacteria and the C. difficile, there is a different ratio in that. There is an altered ratio. And there is a higher ratio of the Enterobacteriaceae and bifidus bacteria abundant at 3 months in those that they are becoming overweight or obese children. The higher ratio, in addition to C. diff colonization at 12 months, was linked to the atopic sensitization, and they said that this is the main pathway. Is this true or not? I will tell you shortly. To sum up, early life exposure will influence the gut microbiota, and that will end up either normal microbiota or dysbiotic intestinal microbiota. When you get a normal microbiota, it means that you are getting normal immune system and normal intestinal homeostasis. And if you get a dysbiosis, you end up in immune dysregulation, abnormal immune system. How this can be normal or change it to abnormal, or abnormal change it to normal, those are influenced by the early life exposure, like diet, birth method, infections, antibiotics, and household exposure, etc. So now we know that the gut microbiome plays an essential role in systemic health, affecting all the what we call the gut systemic autoimmunity axis, from the GI, from the celiac, from the coronary arteries, the osteoporosis, the depression, the joints, and rheumatoid, and then diabetes, as well as definitely asthma and fatty liver. What is the evidence? I'm like telling you this here, but what is the evidence for the gut microbial activity and the airway mucosal immunity? If you go through the literature, you will be overwhelmed by the amount of literature published for the effect of the microbiome in asthma. I've chosen a few pivotal studies for you that we can get some conclusions for the future. One of them was published around 3 years ago about the association between intestinal microbiota and the allergic sensitization asthma. And they had a systemic, it's a meta-analysis for almost 2,000 studies with 47 studies pulled out of it. They followed the kids from birth, and some of them, they actually followed them to 5 years of age. They found that the greater relative abundance of Bacteroides, Clostridia, and Enterobacteriaceae, and lower relative abundance of Bifidobacteria and Lactobacilli. And those are the ones that associated with eczema. Remember those names? I will add some more names and more studies. The association was found only in children, infants, but not in older children. Why? Maybe the early life microbial exposure plays more important role, and also the study designs. What's still unknown, what is the individual species, it's like group of bacteria, and what is the role of other viruses, fungi, or parasites, and what is the time to give pre or probiotics. Still up till now, we don't know. I encourage you to read about the Canadian study, which is the child study. It is the Canadian Healthy Longitudinal Development Study that talks about the genes and the environment. It's a huge study with a huge amount of money invested, with 100 almost publications, and you can go through this website to pull for free all the studies that they have published. One of them was published regarding the risk of childhood asthma in particular, and they looked at the 300 children, and they looked at the risk of asthma in the first 100 years of life who exhibited transient gut microbiota. They looked at what are those. There are 4 bacteria. Maybe those are new names for us or unknown, but you will hear them a lot. Those are the 4 that they were decreased if the patient is if the infant is gonna develop asthma, because they found also decreased fecal acetates. How they proved that? They had mice, the germ-free mice, and what they did, look at the germ-free mice intestine, they give them the stools of asthmatics. So they ended up having inflammation. Then they provided them with the 4 bacteria that I just showed you, and that had improved the lung inflammation. So it is approved, but they are 4 together. So they proved that the 4 gut bacteria protect children against asthma, and this was published a year ago. More studies came, they said 3 bacteria also can be protective when they looked at all all sensitization, not only asthma, they have to be all together. And you see the negative correlation and the development. And they looked which bacteria are there, which are not there. They found that the atopic disorders at 3 years was associated with decreased diversity, and 3 bacteria were nominated as potentially protective against the desensitization. What are those 3 bacteria? The Coprococcus, the Faecalibacterium, and the Rosbiuria. We always say that microbiome and antibiotics, how this works. A very nice study came up, and then they looked at the antibiotics used in the first year of life, and then they looked at asthma at 5 years. Look with me at the asthma, the blue here, no asthma, and this is the use of antibiotics. And then no antibiotics, 1 course of antibiotics in the first year of life, asthma increases. 2 courses of antibiotics, asthma increases. 3 or more courses of antibiotics, asthma increases. And they said that 20% of children received systemic antibiotics in the first year of life are those among the 6% who are diagnosed with asthma. That means antibiotics increases the asthma risk. How this happened? Does it affect the airway directly? No, it is through the gut microbiome. There is no direct effect like this, but which bacteria then they found? They looked at the Faecalibacterium and the Rosbiuria was associated with no antibiotics and decreased incidence of asthma. While if you use antibiotics, the Clostridium increase, and then the asthma also will increase. Very interesting studies. Then they came up with what we call gut bone marrow lung axis. Instead of gut lung axis, we put the bone marrow. They know that the microbiome will use the dietary fiber, the fermentable dietary fiber, to produce short-chain fatty acids, and those short-chain fatty acids will gain access to the circulation, and they will go to the bone marrow. They will affect the dendritic cells and the macrophages, and they can go also directly to the lung airway, and then they will affect the Th2 activation. So it is through the hematopoietic system. That's why they call it gut bone marrow lung axis. The dietary fermentable fibers metabolized by the gut microbiota, they found that bacteroides increase and firmicutes decrease, and these short-chain fatty acids will decrease the lung inflammation. What they found is that they give the mice the high fiber diet, and they checked the level of this short-chain fatty acids, and they checked the allergic inflammation in the lung. They found that the hematopoietic changes increased the macrophages and dendritic cells precursors, and that after that they impaired the ability to Th2 development with, of course, the atopic sensitization. The effect was through certain receptors that were discovered, G protein coupled receptors, and we ended up saying that dietary fermentable fibers and short-chain fatty acids will shape the immunological environment. What is interesting also, that also relatively published recently, that those fermentable fibers protect against influenza. So if you have influenza, please eat fibers, because the short-chain fatty acids will increase the macrophages, and the short-chain fatty acids will alleviate the neutrophil-mediated tissue damage, and they will promote CD8 that will eat or get rid of the flu. So eating is really, I always tell my patients, rabbit food. So the gut-lung axis, the gut microbiome-derived components, then metabolized short-chain fatty acids influence the hematopoietic precursors and bone marrow, a major site for innate and adaptive immune system. The set point for our immune system is actually determined by age, microbes, and metabolites. What about the bottom line is 3 things: the diversity, then the type of the microbiome, and the derived short-chain fatty acids. They affect the asthma, and with the different types of other microbiota that they will affect the other diseases as well. What about the lung microbiome? I kept saying the gut microbiome. The lung microbiome actually also is related to asthma. The association between the bacterial colonization and the hypopharynx and the development of asthma in the first years of life. The Copenhagen study, the COPASC, this is again major study in asthma that they follow big number of children. They follow they check the hypopharynx at 1 month, then yearly follow up, and they look at sensitization at 5 years. They look at eosinophils, IgE, specific IgE, and lung function, and look at this curve with me. If they are not colonized, then the risk of asthma is less. If they are colonized, it's high. So which one? They're going to ask me. Colonization with the strep pneumo, Moraxella catarrhalis, Haemophilus influenza increased the risk of asthma. Colonization with the staph has nothing to do with asthma. So that means that the bacteria, independent of viral infection, can be a predictor of asthma. This was replicated in Australia by Theo. In another 200 children, they collected the nasopharyngeal sample, the same thing. But what they added here is that they collected the nasopharyngeal samples during viral infections with RSV or flu or human rhinovirus. They kept collecting during health and during disease. And they said that the microbiome influenced the severity and the spread of lung infection. They said that also the same thing, staph and Corynebacterium, they were initially there and they are associated with health, while transient invasion with the strep, the Moraxella, Haemophilus influenza are associated with upper respiratory tract infection and asthma. I will tell you the phylum and the genus. The phylum is the proteobacteria, like the Moraxella, Haemophilus, Neisseria. Firmicutes is the staph, strep, Eleucoccus, Veonella, or Gemella. Then Acinetobacter, then Bacteroides, Prevotella, then Fusobacteria. What are those? The Eleucoccus, actually, you can get it in chronic otitis media. Veonella is a contaminant. It's found in soft tissues, and it's a pathogen in sinuses. Gemella is an opportunistic immune compromise, and Prevotella, you can find it in anaerobic infection. The distribution in different types, and you can see they are different, although the yellow one here, this also in the hair, the one that's called the cyanobacteria is not present in the others, but those are the 6 that are there. The highlights of the study is that the nasopharyngeal microbiome has simply been dominated by 6 types. And the microbiome composition affects the infection severity and the spread to the lower airways. And the early asymptomatic with the strep increases asthma, antibiotics disrupts all that. The air microbiome actually also had been replicated by, again, with Theo, instead of like similar to the Copenhagen group, they also checked the microbiome of 3,000 nasopharyngeal samples from 200 children, and they looked at the recurrence of the upper respiratory tract infection throughout life. They said the same thing, Haemophilus that gradually increases, the ones that they are normal health, associated with normal health, staph, Corynebacterium, Eleucoccus, and the ones that they are associated with pathogenic state, as well as asthma predominance later on, Streptomoraxella and Haemophilus. But what they say also is that colonization, adding to that, allergic sensitization means persistence of the symptoms. Transient wheezers are not sensitized. So they said a very nice figure. You have the organisms. If you are sensitized, the likelihood that you're going to be chronically wheezing, yes. If you are sensitized, not sensitized, and you are colonized, the possibility that you will be transiently wheezing, and that will change at 3 years of age. Wheezing, again, bacteria and sensitization responsible for asthma and for acute exacerbation. The message is early detection to prevent. Early airway microbiome and the potential modification may be beneficial for high-risk infant, reducing the risk of asthma and the lower respiratory tract infections. Infant microbiota in the immune system derived from the Copenhagen study. They looked at, again, the Veonella, Prevotella were associated with asthma, as well as the Gemella. What they found at the high risk, when they are highly colonized, the high risk of asthma is here. Through what? Through decreasing tumor necrosis factor, decreasing interleukin-1 beta, and decreasing those chemokines. That means microbiota is interacting with the immune system. Those are the 3 that they increase the risk of asthma: Veonella, Prevotella, and Gemella. Then take-home message from this: the use of antibiotics should be really wisely taken. early evaluation of allergic sensitization by skin prick and IgE, and encouragement of the exclusive breastfeeding, encourage consumption of healthy diet rich in fermentable fibers, and stay tuned to the continuous update in the microbiome status. I hope I have convinced you that the microbiome plays an important role in the asthma development, but it's just one piece of the puzzle, not all of it. Thank you very much for your attention, and enjoy the rest of your meeting.
Thanks a lot, Professor Sanaa, for this elegant and marvelous, very important lecture about microbiomes and microbiota. And now